So a key to sustainability is hiring good people, and the New York City Health and Hospitals Corporation recently hired Ali. So that was our first step in the right direction. So I I've said a lot. New York is like a village, and half of you have heard what I'm about to say, and I know who you are. So the other half of you, now maybe you'll understand it. So I do two things, as Bev introduced. I oversee mental health services in the New York City Public Hospital System. It's 11 hospitals. Last year it was 900,000 mental health visits. And I'm also privileged to work in various low-income country settings, mostly now Haiti and West Africa, in trying to answer the same questions that I'm trying to answer in New York City, is how you build logic into a system so it has sustainable capacity to reach the scope, to close treatment gaps, to meet the demand that it has to meet in an effective way. And my title, Reaching a Billion Minds and Lives, reflects a number that my life has become more wrapped up into trying to unpack and solve, which is that that's a fair estimate of the global treatment gap for common mental disorders is about 1 billion people. If you look at general estimates of lifetime prevalence and unmet needs, both in this country and others. And so when you start wrapping your head around that number, about the scale that we have to think about the task of sustainability of a system and a capacity, you start thinking about things that we don't often think about in mental health. And one is the role of standardization. And we really have to confront the issues of standardization if we're ever going to solve or meet the challenge of scaling up sustainably. We can only scale what is scalable. And there would be no light if we all didn't agree that light bulb sockets had to be a certain width. And the question is, what are the strategic points of process to standardize care around which scalability is possible while still having fidelity to local contexts, to variation, to adaptation, to all the things, to iterative development, all the things we've been talking about. And so I've settled on 3 sorts of things: design, knowledge, goals. These are areas, these are entry points for thinking about how to standardize thinking or work that can anchor everything else. And my tests for whether that makes any sense is whether they work for me in New York and in Port-au-Prince. This really is a global conversation about how to think about systems. David was, showing ratios of docs in other countries, and often people, when I travel, say, well, it's easy for you to say how to do this or that. You've got 50,000 psychiatrists in the United States, and yet we have evidence that even in the US, maybe about 1 in 5 people with major depression get evidence-based care for it. So we have big treatment gaps here. And the fact is, the problem is, it's not necessarily who you have, but what they're doing and how work is organized. And so we can continue to do problem solve in ways that are clunky and don't work, and then just try to do more of the same. Or we can really rethink some fundamental assumptions we have about the system. And so I talked about design, knowledge, and what was the third thing I said? Design, knowledge, goals. Thank you. So to start with design, I think we have to think about design and mental health work in very different ways. We often think about, well, if we just train the people and send them out there, that they will do good work. We have to think about the work first. What are the basic building blocks of work? And so I've gotten very interested in modular design concepts in completely different fields, from assembly line work to other areas of health that really thought about, well, what are the key active ingredients of skills and tasks that let you actually deliver an evidence-based pathway of care? Let's start from there. And so we started doing that. I've been doing that in New York City and reimagining how to provide addiction care, which is very siloed. So we sort of really cracked down those silos. And in Haiti, where some of this work comes from, where we came up with 5 basic skill packages that we think could actually support any care pathway for any evidence-based practice. And what we did on the left was really detail how those skill packages translated into specific tasks to do a depression care pathway, working off MHGAP, another standard reference. And then the top column are all the people we have to work with in the system that we're working within, which is the Partners in Health, the Zone La Santé system in Haiti. And we found out, as you'll see by the sort of distribution of these blocks, that lots of people could do lots of things. And then when you started looking at the tasks you need to do, when that was sort of your anchor point, your light bulb width, you realize actually that freed you up to have great flexibility. And that's a real smart place to standardize, where it actually anchors you in a way that you can actually that you could actually be very flexible, like letters in the alphabet. Speak lots of languages if you've got the letters right. And we wrote up this model in a paper about a year ago called the 5x5 model, because 5 packages and 5 key sort of implementation rules, also a standard anchor. And that lets you move a treatment guideline, which is what most people mostly start from as standard, and turn that into standard work, into actually a functional working care pathway, which I can't go into in great detail because I have 1 minute. The other big standard piece was design knowledge. And improvement I worry that the global mental health field feels like it has to start from scratch to figure out basic tools for implementation, and it doesn't. Continuous quality improvement has been around for about 100 years, is very science-based, has been used in industry, has been more recently used in healthcare through work by the Institute for Healthcare Improvement in Boston. It's how you take very basic implementation tools and enable systems to hypothesis test in a standard way, to use standard tools to do flexible work. And without standardizing the tools, you can't explode the scale of your flexible work. And that's really a huge lesson that I took from learning about CQI. And actually, the Institute for Healthcare Improvement has shown that you can use these methods in low-income countries for health scale-up, HIV, maternal-child health, and lower infant mortality rates by 30% in Ghana without adding a doctor or nurse, just teaching systems how to hypothesize and look at it and examine its own work. And when you bring multiple clinics or parts of a health system that are working in this standard way, but trying different solutions of how to get there, okay, anchored by the width of the socket, but therefore enabled to do some robust self-solution seeking, is you get to harvest. This is sort of a schematic diagram of something called a driver diagram, which is kind of a central tool in continuous quality improvement, where everyone has the same aim. This box is the same. That's the anchor. But every local clinic or district or region develops its own theory of change as to how to get there, working from an evidence base, but also working with the beliefs, resources that they have. And then they reconvene, and they compare what solutions worked. And that harvests local knowledge for standard purposes and actions much quicker and I think much richer than a lot of the designs and research tools that we have. So I'm now working with the Institute of Healthcare Improvement to apply these same methods to mental health scale-up, and to also put those methods on an open-sourced, open-access virtual workspace so that those tools are available to groups wanting to work together, again, using standard tools for scale-up, and harvesting knowledge in the process. We're starting now in several countries, of which we hope is going to be with David in Kenya. But the idea is if we can build a workspace based on very key, replicable sort of methods for 5 countries, going to 50 is easy because you started from a building block base. Thank you.